Hi, everyone. Hope you're all doing well. I'm Anna Bartz, and I'm an MBA MPP candidate at Duke University. I just wrapped up my health sector management orientation, actually, and I see a couple people on this call that were part of that. So big shout out. I feel like I learned a lot, need a nap after this. So this summer, I've been researching federally qualified health centers, also known as FQHCs, and trying to dig into the current landscape of value-based payments and alternative payment models. If you joined the Margolis seminar a couple weeks ago, you would have heard myself and a couple of my summer mentors, Rebecca and Jonathan, discuss some of our preliminary research and how it relates to health equity. So today I'm going to try to take a different spin on it. If you feel bored, feel free to tune me out, go to a coffee, but hopefully it's engaging. So some quick background on FQHCs before I jump into some of the themes and what I'm thinking about talking about. FQHCs are mission-driven organization. They provide comprehensive primary care to all patients regardless of ability to pay. So with that, they typically are serving those more lower income patients, and they also tend to serve a higher proportion of racial and ethnic minority groups. So really important in this health equity conversation. They're administered through HRSA, which provides them 330 grants to centers that are achieving this accreditation. And just to give you a little sense of the current funding, so 330 grant, which is primarily used to budget for uninsured patients, that's about 16% of revenue. Medicaid is the really big player here. They're about 44% of revenue. I won't go through the other ones, they're a little bit smaller, but in total from 2019 data, it's $31.4 billion that we're talking about here. So a lot of money going into these systems. Admittedly, before working at Margolis this summer, I didn't know that much about FQHCs and safety net providers in general. Prior to coming to Duke, I worked as a consultant in the employer-sponsored benefit space and was really accustomed to working with clients that offered generous benefits to their employees. Many of these employers had robust tools to help employees navigate the complex healthcare industry and to guide them to affordable and high quality care. I myself as a patient have benefited from these tools in the past, specifically thinking about last spring when I was trying to secure a COVID-19 vaccination. Duke Health really acted as my personal concierge. I felt no stress or barriers when securing my vaccination appointment, and that's, a lot of Americans didn't feel like that when the initial vaccine supply was outpaced by demand. So unlike large employers I used to work with, FQHCs don't always have these extensive budgets and can't always invest in some of these programs that really help with care coordination and navigation. However, despite these financial and infrastructure barriers, they're already providing really great patient-centered care and promoting equity. And this can be seen in their efforts as they were trying to vaccinate their patient populations. And as I've been reflecting on this past week, I think this is one of the key points from our research findings and a crucial theme to remember, for future health policy projects. So for FQHCs, it's not that they're providing low quality care. It's really they just don't have the infrastructure or funds to, maybe create some of these outside services. And maybe they're not being reimbursed in the best way that aligns with their mission statement and the services they want to provide. Something we heard in interviews is that health-centered providers may feel offended if research centers come in and tell them how to provide this best patient-centered care. They're really the on-the-ground people, and they don't necessarily need us or states from a 1,000-foot level to tell them how to do their job when they're already really on the ground working with these patients. So instead, as I've been thinking about it, and hopefully as a takeaway for Margolis as well, it is our job as health policy researchers to develop innovative and creative solutions that support the great work that these providers are already doing, and just look for opportunities to collaborate and listen and give these health centers agencies in the decision-making process. So all to say, it's been incredibly rewarding to work on this project this summer and happy to answer any questions offline.